My name is Cassandra. I'm a student at Southern New Hampshire University. I am going to be completing a comprehensive head-to-toe physical assessment on my patient. Can you tell me your initials and your date of birth?
OEG, July 24th, 1998.
Great, thank you. And do you consent to this video being used for school?
Yes.
Okay, perfect. So during the exam, I'm gonna do, certain techniques that will involve listening to certain body parts, palpating, percussion, things like that. Now, typically, if you were in a hospital, you'd be wearing a gown, but for the purpose of this exercise, I will have you stay in your regular clothes. Do you have any questions?
No.
Okay, perfect. So typically, I would close the curtain and draw the door for privacy, and then I would wash my hands. If you have any questions, please feel free to ask during the assessment.
Okay.
If you feel any sort of tenderness, pain, or discomfort, let me know while we're doing the assessment.
Okay.
So the first part of the assessment, I'm going to start with inspecting your head. I'm also going to palpate and check for any sort of abnormalities, growth, discoloration, things like that. Great. Did you feel any pain or discomfort on any of those parts?
Nope.
Okay, good. Okay. Now, can you raise your eyebrows for me? And close your eyes tight. Open them. Puff out your cheeks. Perfect. And I'm going to take a look at your eyes. Just check for any sort of discoloration, dryness, abnormalities, things like that. Let me know if you feel any pain or discomfort. Wonderful. Perfect. All right, so the next thing I would do is I would do a Snellen chart test. So what that does is it checks your vision. If you're able to read the 20th line down on the chart, it usually means you have 20/20 vision, which means you can see from 20 feet away.
Okay.
However, we don't have the chart, so I'm going to have you read a line from this article. So if you could cover one of your eyes, just read the first line.
The burden of prostate cancer is significant. Worldwide, it was the 4th.
Perfect. And then you're going to cover the other eye and do the same thing.
Most frequent diagnosed cancer type with an estimated incidence of 1.27.
Perfect. Thank you very much. So the next thing I'm going to do is I'm going to check your pupils with my pen light, and that's going to check for reactiveness and accommodation to light. So if you could look straight ahead. Perfect. Pupils are equal, round, and reactive to light accommodation on both sides. And then I'm also going to do a peripheral vision test. So what I'm going to have you do is cover one eye, the same one as myself. And when you see the pen light come into vision, say now.
No. 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 No.
Okay, and the opposite eye.
No. 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 No.
Perfect. And I'm just going to move on and check your nose. Do you feel any discomfort there?
Nope.
Perfect. And I'm going to look into your nostrils. Good. No visible abnormalities like a deviated septum. Now, if you could plug one nostril at a time and take a deep breath. Perfect. Now the other one. Perfect. All right, and then I'm also going to have you follow the pen light, look straight ahead, and without moving your head, just your eyeballs follow the pen light. Great. I'm going to do an assessment of your ears. So what I'm going to do is I'm going to inspect the outer ear, and then I'm going to inspect the inner ear. And what I'm looking for is your eardrum, which looks opaque and intact. I'm going to check the other ear. Looks opaque and intact. Great. Now I'm going to check your mouth. So give me a nice big smile. Perfect. Now can you open wide? I'm going to look inside. And can you lift your tongue? Beautiful. So what I'm looking for here is any sort of signs of dehydration or abnormality. Now can you clench your jaw? And I'm going to try my hardest to open it, but don't let me. Perfect. Now I'm going to palpate your arteries up here. Let me know if you feel any sort of pain or discomfort. Perfect. All right, and I'm also gonna palpate for any sort of lymph nodes, and I'm gonna check your jaw. Again, let me know if you feel any sort of tenderness, pain, or discomfort. Now I'm gonna check your jaw, open wide, move it from side to side, and try and jut your jaw out. Perfect. And now I'm gonna do a whisper test. So what I'm gonna have you do is I'm gonna have you plug one ear, just like this with your index finger, and I'm gonna whisper in your ear. And when I whisper in your ear, you're gonna repeat what I say.
It's 90 degrees out today.
Perfect. Now the other ear.
I wore Nike sneakers.
Great. So I'm going to check your thyroid. So this is gonna feel a little weird because I'm gonna feel from the back, but I'm just checking for symmetry and any sort of distension. Do you feel any pain or tenderness?
Nope.
Perfect. I'm gonna observe your back as well, checking for curvature of the spine, any sort of abnormalities. Wonderful. Perfect. All right, and then I'm gonna listen to your lungs, and I'm gonna start with the back. So when I tell you to take a deep breath, just take a deep breath for me. If you feel dizzy or lightheaded at any point, let me know and we'll take a break.
Okay.
Go ahead. Perfect. Your lung sounds are clear bilaterally. And then I'm gonna also take a nice deep breath and I'm gonna check for symmetry. Perfect. And now I'm gonna come around to the front and I'm gonna have you lift your shoulders against resistance. Perfect. And then I'm also gonna palpate your carotids one at a time. Perfect. Wonderful. I'm going to listen to your lungs from the front as well. Nice deep breath. Perfect. Did you feel any discomfort, shortness of breath, difficulty taking deep breaths?
No.
Perfect. So the next thing I'm going to have you do is I'm going to have you lay at a 45-degree angle, so I'm going to put some pillows behind you. And for this step, what I'm going to be doing is I'm going to be observing your jugular veins for any sort of distension or abnormality. So if you could go ahead and lie back and rest against that. Perfect. So now I'm just observing the jugular veins. No distension noted. Perfect. Wonderful. And now I'm going to have you lay flat. And for this part of the assessment, I'm going to take a listen to your heart and assess your cardiac system. So what I'll do is I will first listen with the wide part of my stethoscope, and then I'm going to flip it around and listen to with the bell of my stethoscope. This may feel like it's taking a while because the first one I'll listen for a full minute to listen for your apical pulse, and then I'm going to listen to all of the different chambers of the heart. apical rate was 70, so now I'm going to listen to the different chambers of the heart. And what I'm listening for is the valves in your heart. I'm listening for the aortic valve, the pulmonary valve, the mitral valve, and the tricuspid valve. And those are what control your heart rate and the amount of blood flow that circulates through the body. I'm also going to feel for any sort of palpitations. Do you ever experience any chest pain or chest tightness?
Nope.
Perfect. So now I'm going to listen with the bell of my stethoscope. Perfect. Now while you're laying down, the next part of the assessment will be the abdominal assessment. So typically for this assessment, what I will do is I will inspect the abdomen for any sort of abnormalities, again, discoloration, growths, lumps, things that could indicate hernias. And then I would auscultate, which means I would listen to all 4 quadrants. Then I would do some light palpation and then percussion. And that's just to check for distension of certain organs such as your liver or your spleen. So typically we would have you lift your shirt up, but I'm not going to make you do that. So I'm going to inspect the abdomen for any obvious abnormalities. Great. And then the next step will be to listen. So what I'm going to have you do is just stay there, and I'm going to listen starting in your right lower quadrant, and I'm going to go clockwise. And I'm listening for bowel sounds to see if you have normal active bowel sounds, or if you're having some sort of complication, you may have hypoactive or hyperactive bowel sounds. Bowel sounds are normal active in all 4 quadrants. Are you passing gas regularly?
Yes.
And when was your last bowel movement?
A couple hours ago today.
Perfect. All right, so the next step is going to be palpation. So what I'm going to do is I'm going to gently palpate. So typically we can do a light palpation or a deep palpation. For this assessment, we're going to do a light palpation. Again, let me know if you feel any sort of tenderness in any of your quadrants. Perfect. Any pain or discomfort or tenderness?
No.
Wonderful. So now I'm going to percuss. Wonderful. So now I'm going to listen to the major arteries in your abdomen, and I'll do that with the bell of the stethoscope. I'm going to listen to the abdominal aorta, and I'm going to listen to the renal arteries, and what I'm looking for is a bruit. Perfect. Let's Sounds good. So now I'm gonna do some range of motion exercises with your lower half of your body, specifically your hips. So the first thing I'm gonna have you do is take one leg and lift it straight up. Perfect. You can put that down. And now the next leg. Perfect. Great. So now I'm gonna have you bend your knee towards your chest. Wonderful. Now I want you to curve that knee outward and then inward across the other leg. Wonderful. And you can straighten that leg out and do the same with the other one. Perfect. All right, and you can straighten that leg out. And now what I'm gonna have you do is take this leg and slide it straight out away from your body, and then back in, and then across the other leg. Wonderful, and you're gonna do the same thing with the opposite leg. Great, perfect. So now I'm gonna inspect your legs. I'm inspecting the skin integrity, temperature for moisture, and I'm gonna also check for pulses. Perfect. Great. So the next part of the assessment is this. I'm going to assess your feet. So what I'm going to do is I'm going to assess the pulses on your feet and some range of motion. So I'm going to start with the pulses. We've got good positive pedal pulses. Wonderful. So what I'm going to have you do is I'm going to have you point your toes away from you like you're going towards the floor. Now up towards your nose. And then I'm going to have you turn your ankles in together and apart. And then rotate. Perfect. Great. And now I'm going to look at your toes. Sorry if this is a little ticklish. Let me know if you have any pain or discomfort. And again, checking for skin integrity, temperature, any sort of abnormalities, things like that. Great. While you're in this position, I'm also going to test your reflexes, so I'm going to have you close your eyes, and I'm going to run a cotton swab on different parts of the body. And when you feel them, tell me which body part.
Leg. Foot. Forehead.
Perfect. Okay. So now I'm going to have you sit up. And we're going to assess your hands. We'll do one at a time. And again, assessing for color, temperature, moisture, skin integrity. And then I'm going to test pulses. Perfect. Great. Now if you could take your hands, hold them straight out, face them up, and face them down. Perfect. If you could bring them out to your sides. Wonderful. Perfect. I'm also going to test some of your strength here, so if you could turn your head up, and then down, and then touch your ear with your shoulder. Perfect. Great. Wonderful. Now face the ceiling and bring your palms up over your head. Bring them back, and then palms out and bring them back down to your side. Great. Now I'm going to have you put your palms out straight ahead and squeeze my hands. And right here I'm assessing for a good equal grasp. Perfect. Great. Now I'm going to test the reflexes on your knees. Let me know again if you feel any sort of pain or discomfort. Perfect. Okay, so now I'm going to have you stand up. And the first thing I'm going to have you do is walk straight ahead in a straight line. And now I'm going to have you walk back. Perfect. And now I'm gonna have you walk straight ahead on the balls of your feet. And then I'm gonna have you walk back on the heels of your feet. Perfect. Do you feel any sort of discomfort, dizziness, imbalances?
Nope.
Perfect. Now what I'm gonna have you do is I'm gonna have you stand straight ahead and with your eyes closed, with your arms at your side, and this is called a Romberg balance test. Close your eyes for about 30 seconds. Perfect, feel free to have a seat, and I'm gonna do some strength testing. So I'm gonna have you bring your arms up like this, and when I try to pull your arm away, you try and stop me. Perfect. Now when I try and push toward you, perfect. And the same thing with the other arm. Perfect. And then with your leg, I'm gonna do the same thing. If I try to pull, you don't let me. And when I try to push, you don't let me. Perfect. Perfect. And now I'm gonna try to push your shoulders down. Don't let me. Perfect. I'm gonna try to push your head down. Don't let me. I'm gonna try to lift your head up. Don't let me. Perfect. Now I'm just gonna check the lymph nodes in your arms, elbows, checking for lumps or obvious lymph node growth. Sometimes an enlarged lymph node can be a sign of an infection or a systemic response to infection. Perfect, I'm going to do the same down here. Perfect. And then I'm gonna have you bend forward, and I'm gonna check the curvature of your spine as well. Perfect. Typically during this assessment, we would also do a full skin assessment, and that would involve looking at the skin on your back for any sort of growths, moles, signs of skin cancer, skin breakdown, things like that. However, we won't do that for the purpose of this assessment. And I'm just going to palpate your lungs in the rear as well. And the percussion on the lungs will sometimes have an abnormal sound to indicate sometimes congestion in the lungs or atelectasis or other abnormalities. Perfect. Now if you could stand up for me one more time. And I'm gonna have you bend your knee and then do a gentle, perfect. Now can you do the other leg? Wonderful. All right, you can have a seat. Do you have any questions for me?
Nope.
No? Any tenderness or pain or discomfort during the assessment?
Nope.
Okay, perfect. Thank you so much, and I appreciate it. Have a good day.
You too.